Hi, I'm Brianna Richmond, and this is nasogastric tube insertion for nursing 2 skills. I'm just going to scan the room for you. We're not cheating or anything else. All right, and then here is my patient, Jolene Beerin. Alright, so the first thing I'm going to do is come into the room, introduce myself, and explain the procedure to her. I'm also going to inquire about any nasal surgery she has, any polyps or deviated septums. And then I'm going to set up my supplies with her. And I'll just do some protection here. Some tissue and an emesis basis. Okay. And my thin gloves. This is not a sterile procedure. Alright. Alright, I got my gloves and then the next thing I'm going to do is just kind of assess her nostrils just to see which one's better, if she has any congestion or any kind of breathing issues. In this case, either one would work, so I'm just going to use her right side. Alright, then I'm going to come in and I'm going to measure. So, how to measure is you take the tip of the tube to the nose and then to the ear. And then from the ear, to the xiphoid process. Okay, so you're going to insert about this far. And then we are going to tape it just so I know that that's about a good estimate of how far I'll be going down into the stomach. Okay. And then after that is done, I'm going to come in. I'm just going to coil it around my finger just so it kind of naturally goes into the nasal passageway. And it does. Alright. So after this, I'm going to put some lube on the tube for easy insertion. I'm going to have the patient be sitting at like a 60 to 90 degree angle, and I'm going to have them look straight ahead. And I'm also going to explain to them that if they need me to stop or anything to hold their hand up, we're going to establish a common goal to where if they need me to stop, I can. Alright, and then after that, I'm going to have them tilt their head back. And then I'm going to, just the first time, insert about 3 to 4 inches until they start gagging. So I'm just going to insert, insert, insert. Okay? And then I'm going to stop when they gag. I'm going to have them take a drink of water. Okay? And after this, I'm going to have them, as I push it in, swallow, swallow, swallow. And again, if they need me to stop, I told her to just raise up her hand and I can stop. Right? So I'm going to have them swallow, 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 swallow. Okay. And then the next thing I'm going to do is just kind of tape this to her nose. Okay. And then I'm going to insert we're going to insert 10 to 20 cc's of air into the stomach. And this, sorry, I cannot hear this thing on. This is going to ensure that this is actually into the stomach, and I should hear a swoosh when I insert this air to the left side of the xiphoid process on our stomach. Okay, or the fundus of the stomach. Okay, so. Okay, and I hear a swoosh. So I know that it is in there. Oh, and I forgot. Sorry. I'm going to aspirate some stomach contents too and check the pH, because this also is a good way of ensuring that you are in the stomach. Okay, and then I'm going to come over here. I'm going to check it on my pH. I'm going to compare it, and it says it's 2. Anywhere from 0 to 4 is what acid it should be at, and that means that you're into the stomach. So then, after that, I'm going to make sure the patient's okay, doing good, hanging in there, and then I'm going to hook up the suctioning to intermittent suctioning, and then I'm going to actually take 5 to 10 cc's of air, and I'm going to put it in the blue tube. This is the only time that you actually inject anything into the blue tube. This actually makes sure that the tube doesn't adhere to the stomach wall. So I'm going to inject the air, and then the patient will get this secured to here, and I could tape it to her actual gown, and then I can pin it and just make sure that she has some leeway to move her nose. And after that, I would take my pen light and open up, and I would make sure there's no coiling in the back of the throat and that everything is functioning well. And then I would clean up my supplies, and that is nasogastric tube insertion.